which brings us to the bottom off.
No.
Brings us to reflexes. Spinal reflex arcs. As podiatrists, there are three that we would normally routinely test. The patellar response or the knee jerk is the obvious one. Did we all have a play doing this?
No.
What happened? Okay. No, as you were was fine. Cross your legs again. Oh, we won't.
Wow.
That's it.
Oh no. Oh, it's cold on my back.
You don't want to go over this yet.
No, we don't.
So what we're trying to do is to just lightly tap the patella tendon. So you don't want to wallop the patella itself, and neither do you want to bring up a nice big bruise on the tibial tuberosity. You're aiming for a point somewhere between the two, and just lightly swing your mallet and tap. Maybe not that way. She's dead. Great dead.
I got one.
Yeah. Wasn't very. There you go. You see that? That's the patella response. A lack of response will indicate what? Do you remember those Apaches chasing the Wells Fargo stagecoach through Death Valley in Arizona? Do you remember that?
Yeah. So,
if you get a flaccid nil response, who's basically flogging a dead horse, what does that tell us in neurological terms?
Lower.
That it's a locomotor problem. Yeah. If, on the other hand, you see why I'm standing to one side of her, the reflex jerk, the knee jerk, is exaggerated.
Oh yeah.
That would tend to suggest an increased muscle tone, a spastic tone, and that would tend to implicate the upper motor neuron. So we can tell the state of play by that. Occasionally you'll find that for some reason or other it is very difficult to produce that response. And before you write the patient off as being brain dead or hemiplegic or whatever, you need to perhaps see if you can do something else to produce a good jerk. And the way to do it is to have your patient clench the fist as tight as they can. Do that for me. Really tight as you can. Close your eyes and really, really stress. Okay, isn't it? Okay. Why does that work? As you guess. It's thought that maybe you increase the muscle tone. I'm not convinced. I think it's more a distraction. Just a distraction ploy. Get them to do something else whilst you have a go. The knee-jerk response. There are two more that I'd like to show you. Can you take your boots off again?
And sock.
Well, yes, okay, take your sock off. I just want you to kneel now, if you will. Kneel up like that. That's it, yes, exactly so. And we will have a look at the Achilles tendon reflex. Now all we've got to do here is to tap the Achilles tendon. A positive normal reflex will have the foot plantar flex. Sometimes you need to just sort of tension it first. But we'll just see if we can get something without that. Yes, you see that? So that then is a normal calcaneal reflex, or if you prefer, Achilles tendon reflex. And the last one, keep a good look at this now. Watch what you see. That's a plantar reflex.
and is known as the Babinski response. A normal Babinski for anyone 2 years of age or plus is a flexion response. They will tend to curl the toes, or in this case you sort of certainly plant a flex toe. If the response is to extend the toes and to extend the IP joint and MP joint to the digits, and what's more, to sort of splay and fan quite like, that is an abnormal or a positive Babinski, and tends to suggest upper motor neuron problems. It's an abnormal response. But be careful, if you do this in a neonate, in a baby, they will automatically extend and fan the toes. So if you've got a baby at home or a captive baby of somebody else's that you can play with, try that Babinski response on. If this one not yet started to walk, you will see that they'll splay the toes like that. But if an adult does it, there's something desperately wrong with them. Okay, I think that will do us. Any questions?
Can I ask you about a spotter mic? Am I allowed to?